So it's me, and I decided to go and ask questions through Cafe Mom to see what people wanted to know about Austin, about special needs kids. And I'm still gathering a lot of information from some of the stuff that people asked about, and some of the special needs moms that are coming to me and asked, "Hey, can you find this out for me?" So this is what I got so far. So I got EES Mommy, and she's in the newcomers group, and she asked these questions. How do you deal mentally and emotionally when you are given the news? And let me see. This is what I wrote to her. I said, this is something people ask me a lot. I wrote for a magazine called Complex Child e-magazine, and what I wrote was about being optimistic. The thing I've noticed at this point, my view has changed from the beginning till now, where I was really depressed at first, and I thought, I did this. This was my fault. Why did I do this to my child? And now I am more to the point where I'm like, God gave me this child for a reason, and I am so blessed to have him. Where would I be if I didn't have him in my life? So that's a big thing too. How often in treatment do you question your doctor's second, um, or get a second opinion? I said, I'm getting to the point where now, um, if Austin's having more seizures, I'm kind of noticing, hey, this is getting bad. Hey, they may up his medicine, or they may say, hey, we're gonna have to try another course of action, which I'm always ready for that. And just in case something was to happen, I know the risk of many of the seizure medicines that would help him. When I first started out, I allowed them to do what they thought was right. Besides a couple times where they wanted us to do ACTH for his infantile spasms. ACTH is a steroid shot in his leg. You have to monitor his urine, his blood sugars, and you have to give him the shots 2 to 3 times a day, which could cause infections, and his risk of infections is up already. They try to push this on us. He would basically be with his weakened immune system, he'd either have to spend most of the time in the hospital, or, sorry, I'm trying not to sneeze, or he would have to stay home in a bubble, live in a bubble for 6 whole weeks. And that would be hard because we would have to be gloved to hold him. We would have to go through a lot more precautions because of his weakened immune system. We did fire a neurologist because we didn't agree with what she was doing. And I hired Dr. Patel. And Dr. Patel was the kind of person that would tell me how it is, what he's going to do for the circumstances, and what he thought was the best solution for this. And he deals with complex cases of epilepsy, which Austin has. So that was a big thing for us, and we hired him. The biggest thing about standing up for your child, being an advocate for your child, is you have to have thick skin. Okay, I cry a lot. If I go to neurology, guess what? I'm going to cry at least twice. 2 times. Once would be really good. Most times it's 3 or 4 times. My friend Lauren and I talk about it all the time because the Dr. Patel is really good. But when you have a child who has all these issues, especially neurology, it's going to be a hard appointment. And I'm sure there is at least one appointment for each person that you have that's really, really hard. And that's ours. And do you feel that people look down to you and thinking you have done something different, etc.? I have had people in the past who would believe that we were living off the state, and that's not true. Austin does have insurance through the state because we looked at our bills from him being in NICU and everything. That was over $100,000. If you think about his medication alone, one of his medications for a month is $2,300. because it's a hard drug. It's a seizure medication. Um, and fortunately, we haven't had to pay out of pocket for anything yet, much. Sometimes medications when we were on Molina, but unfortunately, fortunately, we got rid of that and got regular straight Medicaid because he's disabled and has so many issues. They felt that would be the best, for that. So, those are the questions that I'm answered. Thank you, EES Mommy. EES is also a drug that Alex or Austin takes. So, um, then we have questions from people. I'm looking. There was a question I didn't understand, so I had her clarify for me what something means. I'm just waiting for her to reply back to that. There's one more in newcomers. Okay, so what it was is, what is your child's diagnosis? And this is from Aurora Dove, in newcomers group. What's your son's diagnosis? His diagnosis is spastic quadriplegic cerebral palsy, infantile spasms, which is categorized under epilepsy as also. Infantile spasms happen with kids who have more brain damage than they thought. Sometimes it happens to normal kids, but normally to kids who have severe brain damage. Spastic means, spastic quadriplegic cerebral palsy means he's got brain damage and it affects all four of his limbs, his spasticity. He's got laryngomalacia, which means the voice box, the floppy skin around the voice box. Tracheomalacia means floppy skin around the trachea. Torticollis, which he likes to favor his one side, so he's got a muscle right here that's ultra tight and a little bit of spot that's not rounded. High muscle tone means that he's more tenser than normal. Pyloric stenosis makes you throw up, but he had surgery for that. He aspirates, which means he'll throw up and it'll go into his lungs, which causes pneumonia 9 out of 10 times for him. He has a pause in his heartbeat. He has a low immune system. He has GERD, which means reflex. Failure to thrive because he's been 15 pounds. Well, he's been failure to thrive for some time. That's why he's got a J tube. And failure to thrive is, basically he can't keep the weight on. He's 15 pounds. Well, actually 16 pounds, 5 ounces last weight, which is up. But with all his diagnoses, they can hurt each other. So with his laryngomalacia, tracheomalacia, when he was having breathing problems because of his croup and his pneumonia, his throat was closing up and he was having so much issues with the floppy skin going down more, and struggling to breathe even more than normal. His seizure medicines slow down motility, which means it causes a lot of GI issues, intestines and bowel movement issues. And then she asked about creative ways to keep him occupied. Talking to him, music, everything. He loves people. He loves to be held. He loves to be cuddled. He loves to be worn. I am attachment parenting, so I love wearing him. Also, discipline. We don't discipline him. He doesn't get into any trouble. So he's a good boy. I mean, I don't see a reason to discipline him, okay? Our biggest challenge is staying out of the hospital and finding a home for him to live for a while. Sorry, guys. Oh, little one waking up. Can you say hi? Can you say hi? Say hi. Finding a house that will grow with our family and work with him for as long as we can while he's even in a wheelchair. So, those are two people's questions that I've answered, and I hope that helps some people understand, at least from my point of view. If you have any comments or anything like that, you can feel free to comment, and I will answer. Thank you.